Hello, my name is Jessica Perez, and for my CAP project, I chose to do the sport cross country at the high school level. The first injury that we're going to look at is Achilles tendonitis, and Achilles tendonitis is an overuse and degeneration issue. Is when the athletes are doing an excessive amount of running in this sport, which can lead to a tear in their Achilles tendon. Mechanisms of injury. Achilles tendonitis occurs when there is an overuse or doing too much too soon when the tendons are not used to the movement. This is common in beginning athletes, people who are just coming into the season or who are trying out for the first time or not used to the amount of running that is placed on them, which can lead to a tear in their Achilles tendon. Anatomy and assessment. For anatomy, the Achilles tendon is a tough band of fibrous tissue that connects the calf muscle to the heel bone. The Achilles tendon is also called the calcaneural tendon. The gastrocnemius and soleus muscles unite into one band of tissue, which becomes the Achilles tendon at the low end of the calf. The Achilles tendon then inserts into the calcaneus small sacs of fluid called Ursae cushions and Achilles tendon at the heel. The Achilles tendon is the largest and strongest tendon of the body. When the calf muscle flexes, the Achilles tendon pulls the heel. This movement allows us to stand on our toes when walking, running, or jumping. Despite its strength, the Achilles tendon is also vulnerable to injury due to its limited blood supply and the high tensions placed on it. For assessment, athletic trainers will be able to notice if their athletes are complaining about a pain at the back of the heel or ankle, there is redness, swelling, or restricted movement. Next is plantar fasciitis. Plantar fasciitis is a common cause of heel pain. The plantar fasciitis is a flat band of tissue, a ligament, that connects your heel bone to your toes. It supports the arch of your foot. If you strain your plantar fasciitis, it gets weak, it's swollen and irritated or inflamed. Then your heel or the bottom of your foot hurts when you stand or walk on it. Mechanisms of injury. Plantar fasciitis occurs when plantar fasciitis occurs when the movement or ligament is also overused. Plantar fasciitis is also known as plantar fasciopathy or jogger's heel. It's a condition characterized by the structural deterioration for fibrosis and pain of the plantar fascia of the foot. Plantar fasciitis results from progressive damage from repetitive strain and overuse of the plantar fascia. Factors increasing the stress on the plantar fascia, such as increased physical activity, excessive weight, age, or involvement in activities causing repetitive damage to the foot, have been identified as increasing the risk for this condition. The fascia may become inflamed and eventually even tear if there is sufficient pressure exerted on the bottom of the foot. The pressure may result from sudden turn or landing that causes the arch to flatten or the toes to spread. In most cases, this tends to develop over time. Some athletes are predisposed to the condition because of pronating feet. This means that the feet pattern and roll inward while walking or running. Anatomy and assessment. The plantar fasciitis is a pain caused by degenerate rotation at the insertion of the plantar fascia on the medial process of the calcaneal tuberosity. The way athletic trainers can assess it is pain similar to shin splints because of the inflammation and the tear around the surrounding muscles and ligaments. And there will be a pain when walking or to stand, and a burning sensation in the heel. Shin splints. Shin splints are an impact injury caused by the pressure that is placed on the leg when the athletes are running based on the terrain that they are running on. Shin splints occur when the pressure on the leg, especially an unaccustomed or extreme impact, occurs. The shin bones may develop shin splints as they try to absorb the impact of physical activity, especially vigorous physical activities. The muscles in the lower leg include the tibialis anterior, gastrocnemius, extensor digitorum longus, and soleus muscles, work as a support muscles for the shin bone but may not be able to absorb enough impact to avoid the development of shin splints. Anatomy and assessment. The injury affects the tibia and the tibialis anterior muscles, or tibialis posterior muscles. The function of these muscles is to control the foot positioning during exercise. Their main roles are to dorsiflex the foot and to control our arch during weight bearing. These muscles attach to the posterium, a thin lining or connective tissue that covers the bone surfaces. The posterium contains many more nerve endings and blood vessels compared with its adjacent bone, making it particularly sensitive and painful structures when it becomes inflamed or from overloading. Assessment. An athletic trainer would address any calf muscle tightness, any muscle imbalances, and can be treated with ice or compression sleeves or athletic tape.